today's topic, we are going to be talking about understanding depression, the symptoms, and treatment efficacy. What is depression? Depression is a serious and common mental clutter affecting cognitive thinking, sense of feeling, behavior, and worldly understanding. These will typically be in a negative way. According to a national survey in Washington, D.C., about 18% of people have experienced depression in 2023. 3 out of 10 of these adults have at least once in their lives faced depression through diagnosis. In Canada, the prevalence of depression climbed to 5.8% and 3.6% in 2012, which shows 1.6 times higher incidence in women, from 5.0% in women and 2.9% in males in 2002, shows 1.7 times higher incidence in women. Depression can be caused through life circumstances, culture, and other conditions that occur with depression. For example, in women are actually way more likely to be depressed than men. Let me tell you why. So, things like puberty, premenstrual problems, pregnancy, postpartum depression, and premenopause and menopause can definitely give women depression. Symptoms of depression. You would find feelings of sadness, annoyance, emptiness, anger, losing enjoyment or interest in things you used to once appreciate, appetite, so that would be probably eating quite a lot less or eating a lot, which will make your weight fluctuate, sleeping excessively or too little, developing insomnia, heightened weariness or exhaustion, an increase in aimless movements, feeling sorry or unworthy, forgetting, having trouble focusing, concentrating, and also being quite indecisive. And another symptom is suicidal thoughts and attempts to suicide. Effective treatments for depression would be medication, supportive therapy, and interpersonal psychotherapy, and CBT therapy. CBT therapy is cognitive behavioral therapy, which involves both cognitive and behavioral elements. The cognitive element aims to identify irrational and negative thoughts which lead to depression. The aim is to replace these negative thoughts with more positive ones. There are a lot of physical symptoms such as disturbed sleep, low sex drive, lack of energy, unexplained aches and pains, constipation, and things like that. But there are also social symptoms, for example, social withdrawal, where you avoid contact with friends and taking part in fewer social activities, neglecting your hobbies and interests, and having difficulties in your home, work, or family life. These symptoms can create a really big impact on one's daily functioning and quality of life, where they could make their mood persistently sad, energy levels continuously feeling fatigue and a loss of energy, their cognitive function, so depression often impairs their concentration, decision-making, memory, insomnia, oversleeping, weight fluctuations, the list goes on. Types of depression. So there are quite a lot of types of depression, or the 4 main ones would be major depressive disorder, which is known as MDD, persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities are a few symptoms, and these must be present for at least 2 weeks to be diagnosed with. Persistent depressive disorder is also known as dysthymia. Long-lasting depression and this lasts for at least 2 years, these symptoms. Bipolar disorder is alternating periods of depression and mania or hypomania. Symptoms similar to those of major depressive disorder. During manic or hypomanic episodes, they may experience elevated moods, increased energy, and impulsive behavior. Seasonal affecting disorder occurs at a specific time of year, usually during the winter months when daylight hours are shorter, and symptoms of SAD include low mood, irritability, and changes in sleep and appetite patterns. A few differences and similarities among these types are, so the differences are duration. So for instance, with major depressive disorder, the symptoms must be present for at least 2 weeks. However, in persistent depressive disorder, these symptoms should be at least shown up for 2 years. And also in bipolar disorder, you have the presence of mania or hypomania. A few similarities are depressive symptoms, for instance, the persistent feelings of sadness, hopelessness, fatigue, impact on daily functioning, how that's going to affect one's sleep, one's weight, one's behavioral and thought processes, and also the treatment options, for example, medication, cognitive behavioral therapy, psychotherapy. Here are some of the differences and similarities between the seasonal affective disorder and the bipolar disorder. Few examples are differences: they may only experience these symptoms during other times of the year and experiencing mania, and with bipolar they might not have a seasonal pattern. And similarities would be they occur regularly, either each season or cycles throughout the year, and atypical depressive symptoms increase sleepiness and weight gain. Let's talk about medication therapy. So this is a journal of psychopharmacology, and this is about medication therapy. So Brown et al. Conducted a meta-analysis on 2 kinds of antidepressant drugs that are frequently recommended for depression. A total of 4,500 participants from 25 randomized controlled trials were included. Findings were that when they were compared to a placebo, both SSRIs and TCAs were useful in lowering depression symptoms. However, there was no appreciable varieties in the overall effectiveness of treatment between the two. But when compared to TCAs, SSRIs were linked to a lower risk of side effects, including cardiovascular problems and anticholinergic side effects. The evaluation of research methodology and sample size were that Brown et al. Reduced the possibility of bias and confounding variables by incorporating only RCTs, which improved the meta-analysis's internal validity. Sensitivity and subgroup analysis were carried out to evaluate the robustness of the findings and investigate possible sources of heterogeneity. And a total of 4,500 participants from 25 RCTs made up the sizable sample size of the meta-analysis. The findings can be more broadly applied to larger populations of MDD patients due to the high sample size, which also boosts the analysis's statistical power. However, there are a few implications for clinical practices. So both SSRIs and TCAs were found to be effective in reducing the depressive symptoms. However, SSRIs, they may be preferred as a first-line treatment option due to the favorable side effect profile. They don't have too many side effects compared to the other drug and lower risk of adverse effects from that. Clinicians should consider individual patient factors when selecting the most appropriate antidepressant treatment. So they should look into one's comorbid medical conditions, their medication tolerability, and when selecting the most appropriate treatment. So this suggests that treatment decisions should be based on a very careful assessment on the balance between efficacy and tolerability for each patient, because each to their own, and shared decision making between clinicians and patients informed by the latest evidence, so that they can understand and optimize treatment outcomes and improve the patient satisfaction in the management of their depression diagnosis. Psychotherapy, effectiveness of cognitive behavioral therapy for depression. So, Johnson et al. Aimed to assess the effectiveness of cognitive behavioral therapy for depression by synthesizing data from randomized controlled trials. The meta-analysis included 20 RCTs with a total of 3,000 participants. The results were indicated a significant reduction in depressive symptoms among individuals who received CBT compared to control groups, such as waitlist controls or treatment as usual. CBT, however, was found to be comparable in efficacy to antidepressant medications, with no significant differences in treatment outcomes between the two modalities. The evaluation of research design and control measures include that by focusing exclusively on RCTs, Johnson et al. Minimized the risk of bias and confounding variables, which inevitably enhanced the internal validity of the meta-analysis. Sensitivity analysis and subgroup analyses were conducted to assess the robustness of the findings and explore potential sources of heterogeneity. Control measures such as placebo controls or attention placebo controls were utilized. In many of these included RCTs to account for non-specific treatment effects and placebo responses. Comparisons with other treatment modalities. The meta-analysis found that CBT was equally effective as antidepressant medications in reducing depressive symptoms, highlighting the efficacy of psychotherapy-based treatments for depression. While both CBT and antidepressant medications have demonstrated efficacy as standalone treatments for depression, their combination may yield even greater benefits for some individuals. Further research, however, is needed to possibly elucidate the optimal sequencing and integration of psychotherapy outcomes in depression. Lifestyle interventions. The effectiveness of lifestyle interventions for reducing depressive symptoms is a systematic review and meta-analysis. The author is Smith J. Johnson. So Smith et al. Aim to evaluate the effectiveness of lifestyle interventions in reducing depressive symptoms among individuals diagnosed with depression. The researchers included randomized controlled trials and longitudinal studies published between 2010 and 2020 that assess the impact of lifestyle changes such as physical activity, diet, modification, sleep, hygiene, and stress reduction techniques on depressive symptoms. The evaluation of research outcomes. That the findings of this systematic review suggest that lifestyle interventions can be effective in reducing depressive symptoms. So this is, for example, by targeting modifiable lifestyle factors such as physical activity and diet, these interventions, while some studies included that in the meta-analysis reports sustained improvements in depressive symptoms over follow-up periods up to 1 year. Others found that treatment effects diminished over time. Consideration of potential biases and confounding variables. So publication bias may have influenced the inclusion of studies with positive outcomes. Variability in study methodologies, participant characteristics, and intervention protocols could have been introduced heterogeneity into the meta-analysis, affecting the possible generalizability of findings. Future researchers should also aim to address these methodological limitations and provide more robust evidence of the effectiveness of lifestyle interventions for depression. Critique of research on effective treatments. So for the first peer-reviewed article on lifestyle changes for depression, a strength would be that the meta-analysis synthesized data from multiple studies. A limitation would be that the publication bias may have influenced the inclusion of studies with positive outcomes, which potentially probably skewed the overall effect size estimate. For psychotherapy-based treatments, a strength would be the meta-analysis included a substantial number of randomized control trials, which enhanced the statistical power and generalizability of the findings. A limitation would be that the variability in therapist training and adherence to treatment protocols may have influenced treatment outcomes, leading to challenges in standardizing interventions across studies. The third peer-reviewed article on medication-based treatments or depression, strengths would be the meta-analysis synthesized data from a substantial number of RCTs, providing a comprehensive evaluation of the comparative efficacy of selective serotonin reuptake inhibitors. And a limitation would be that the publication bias may have influenced the inclusion of studies with positive outcomes, potentially skewing the overall effect size estimate. So here is a limitation of the study design, which includes limited generalizability and sample size and participant characteristics. Conclusion and future directions. So to sum this PowerPoint up that I have, so in conclusion, depression manifests through a range of symptoms, including persistent sadness, loss of interest or pleasure in activities, changes in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. Critically evaluating research on effective treatments for depression reveals a multi-phased landscape. While psychotherapy, particularly cognitive behavioral therapy, and medications such as selective serotonin reuptake inhibitors are commonly recommended and supported by peer-reviewed studies, the effectiveness of each varies depending on individual factors and the severity of depression. And additionally, emerging research suggests that promising avenues such as mindfulness-based therapies and lifestyle interventions emphasizes the importance of personalized treatment approaches. So overall, continued rigorous investigation is essential to refine and expand our understanding of depression and optimize treatment outcomes.